My name is Angelique, and I have a 14-year-old daughter that I brought to Dr. Jotty. Constant throbbing headache, and initially we thought that maybe the headache was the problem, although for quite some time she had had lots of other symptoms. And so her symptoms included the inability to adjust to heat, and cold was always kind of an issue as well. On top of the headache, she also had extreme fatigue, an inability to go to school almost really for a month, because doing schoolwork or being up and about for a long period of time, and even laughing with her friends, made her feel dizzy, very lightheaded, and also she had a lot of gut issues. She, for a year, was unable to eat gluten and carbohydrates and things like that. And so we were dealing with a lot of issues that started to really compact. And we came to Dr. Jotty because a friend actually recommended him, and it's been such a blessing that we've been able to come here. In 5 days, her headache for about a month was about a 7 on a scale of 1 to 10. And she had a hard time sleeping, getting to sleep. She was waking up throughout the night. And within 2 days, the headache had gone down to a 6 and then a 5 after, I think it was just 4 days worth of treatment. And although that was something that my husband and I were kind of focused on, we came to find out through Dr. Jotty and through a series of tests that she actually had something called POTS disorder. And this is a syndrome and something that affects kids, I guess, around her age, but can compile through decades worth of not dealing with the autonomic system. And she had all of these issues that within a week, Dr. Jotty started taking care of, to where she didn't have lightheadedness anymore. There was no dizziness anymore. She's now able to eat anything that she wants. So this gluten intolerance isn't actually anything that's even real. Not for her. This is something that was part of this disorder. And so to see the smile on her face, she can now get sleep, she can eat, she's not lightheaded, she can laugh and feel okay. The throbbing is not really a throbbing anymore in her head. It's maybe a dull pain that we're still working through, and I have absolutely no doubt in my mind that when we're done with this treatment here, that it's all going to be taken care of, and it's something that she's going to be able to now say, yeah, I had this disorder, but I beat this disorder in just a couple of weeks. I think that with Dr. Jotty, he gives you a diet to follow that's not hard. He gives you exercises to do when you're not at his office that also are not hard. But when you work the program, it works. And I cannot even tell you how blessed we feel to have found Dr. Jotty, and how incredibly quick it is, but just how it works. And no other doctor has been able to treat her. We've been to ERs and neurologists and endocrinologists and family physicians, and they've all told us something different. And yet everything they've told us and everything they've tried to treat hasn't worked. Her syndrome, I guess, was getting worse. And it's frustrating as a parent to go to a doctor who's supposed to be able to help you, and nobody can help you. And you just get more and more and more tense. But as soon as you walk into the doors of this office and you talk to Dr. Tina and you talk to Dr. Jotty, they put you at ease immediately and can see kind of the frustration or the fear that you have in your eyes, and they're quick to really put you at ease and say, don't worry, we got this, we're going to take care of it. And they do. And it's just been something that has been a blessing to us and our family, and we're going to miss them when we're not here anymore. But we're glad that we're here. So Ariana has actually been suffering longer than 2 months. She had a 2-month-long headache, and I think it was the headache that was our big concern. You know, a 2-month-long headache, I've never heard of such a thing. You know, usually you have a headache and you get some medication, or people with migraines can take a migraine shot and it gets rid of it, you know. So that to us was our big fear, a 2-month-long headache. But actually, I think looking back, after hearing Dr. Jotty speak of this POTS disorder, she had been having symptoms for years. the gluten intolerance, this inability to eat. The losing weight because of that had been going on for a year or more. 6 months worth of her just not even wanting to eat, period, because it hurt every time she ate. She would have a headache here and there. Fatigue was probably a part of this for at least a year. So the symptoms actually had been going on for a long time. It was just the headache for 2 months. I think when I mentioned that 2-month long throbbing pain, and you can imagine you can't function when you have a headache for a day or 2 days, let alone 2 months, and you're 14 years old and all you want to do is go to school and hang out with your friends, and she hasn't even been able to do that. So yeah, it was actually symptoms for quite some time. In regards to the neurologists and cardiologists and people who are supposed to be leading in the industry, we're from San Diego, and so we've been to Children's Hospital. We've contacted UCLA, USC, neurology departments everywhere from LA to San Diego. And we've been in the emergency room with this headache because it's been so debilitating. And they all want to treat it as, oh, you have a headache? Well, let's look at the headache. Does the antidepressant, the anti-seizure medication, the steroids, none of it works. The beta blockers, everything they try, and yet they weren't willing to look at all the other symptoms that I was trying to tell them she had. I feel like if they're going to tell us, oh, she just has a migraine, then some sort of migraine medication should work. And when they try 4 or 5 different things for a migraine, eventually something should start to help. And it didn't, and that's what's so frustrating. So we've gone down the road of the leading children's hospitals, the leading hospitals as far as universities go, and it didn't work. And let me say something else too about Dr. Jati. A lot of people will say, gosh, it sounds too good to be true. No medication, no surgery. What do you have to do? I'm telling you, he figures out what's wrong and pinpoints that part of the brain that he needs to work on. And there is nothing crazy about it. I mean, you would think the simplest treatment and almost too good to believe, like this really is gonna treat this, and it does. That helps with her particular condition with the autonomic system. It does, and I wouldn't sit here if it didn't work, and it's worth every bit of it in time, in dedication to working the program in and out. It's worth every bit of it. And as a parent, you'll do anything for your kids to feel better. And we'll continue to tell people about this place as much as we can.
Hi, my name is Ariana, and for the past couple months I have had a throbbing headache like in the back of my head, and it just would not go away. And we went to several different doctors and ER doctors and just everything, and they've given me migraine shots and everything that they could do to treat the headache, and it did not go away. So we came to Dr. Jati, and then my headache on a scale from 1 to 10 was about like a 7 when I came in, and it had been like that consistently, and I was not able to, I could barely like go outside, I couldn't walk around much, I couldn't really do anything because everything made it worse. And so we came in here like that because nothing was changing it, and then the first day of treatment went well, and then within the first couple days my headache went better, and it went down to a 6 and then to a 5 just by the end of the first week. And yeah, I couldn't go to school for several weeks because concentrating made it worse, and every time I stood up I'd get lightheaded, and my face was red all the time, and just I couldn't barely do anything. So yeah, I couldn't go to school, I couldn't go out and do things. Everything was super bright and everything was really loud, so I just sat like in a dark room for several weeks and couldn't really go out to eat and go out and do anything. I was tired constantly, and I couldn't eat anything because everything hurt a ton, and I didn't even want to eat for like 6 months just because it hurt every time. And I couldn't, I'd go out with my friends and they all have pizza, and I couldn't eat it, and I couldn't eat anything, and so that was very difficult. And so yeah, tired all the time, and every time I stood up I'd get lightheaded and I'd have to sit back down, and it was very difficult. Dr. Jati is very different from other doctors that we've been to because all the other doctors, they all thought, oh, you have a headache, we'll give you some medicine, it'll help with the headache and you'll be fine. But it didn't, and I had all these other symptoms, and they're like, but you have a headache, so let's give you a bunch of medicine and all these different things, and they didn't do anything. And they would only treat the headache. So we came here, and Dr. Jody, okay, you have the headache, what other symptoms do you have? And then he told me that I have POTS disorder, which is why I had all of the symptoms. And then he treated the part of the brain that was causing all of the symptoms and not just giving me some medicine and hoping it works. I think Dr. Jody works very fast, and you'll go on for so long, for maybe several years, and you go to a million different doctors and just not getting any results, and it's completely hopeless, and you're like, I'm just gonna have to deal with this forever. But then you come to Dr. Jody thinking, okay, let's try another doctor, and then you start feeling better within like a week or a couple days, and it's definitely gives you a little more hope, and you think, okay, like, let's get rid of this. So it's good.